I'm going to be an advocate for early childhood. I think healthcare must be available to all children in Multnomah County. It should be available to all children, period. I'm going to advocate for early Head Start programs and for visiting nurse programs. These are evidence-based programs. They help the child, they help the family. They're great for siblings that might be in the family. We know that they're a good investment of public dollars. That's my first priority. I'm also a public safety expert, and one of the areas of public safety that we need to work on is to provide more addiction treatment, because we know that addiction is really the root of property crime in our community. We also need to properly fund community mental health services so that we can remove the mentally ill from our jails and take care of them appropriately in the community. My third priority, when I'm elected, we are going to be aggressive about pursuing infrastructure projects such as the repair of the Selwood Bridge, the new East County Justice Center, and a downtown courthouse. These are projects that's totally appropriate for government to be involved in. They create family wage jobs that have pension and health benefits, and they have magnifier impacts that will be good for economic development county-wide. And I think that Jefferson is a great example of an opportunity that we have to work together with the Portland Public Schools. I think this partnership is just crucial. I think we need to re-examine suspension and expulsion criteria and make sure that we're coordinating so that we're not creating more problems by suspending and expelling kids who really need to be in school. And when we do suspend or expel them, I think that the appropriate social services in Multnomah County need to be brought in on that case so that we're providing the needed services to the child and to the family. And this is going to have an impact on our gang situation as well. I really think that it fits into my priority programming to also be an advocate for successful high schools, to be a cheerleader for Portland's public school system, to help bring the arts, to help bring music, to bring even more and better athletic programs so that our children have these activities in their lives. Kevin Mannix's measure is reckless, it's irresponsible, it is going to not only explode the county jail population, but it's going to create a building program for state penitentiaries and for the Department of Corrections that is going to suck all of the money out of education programs. So going back to the earlier questions that you asked about gang intervention and supporting high school, and my premier priority of supporting early childhood, there will be no resources for those programs. We know that treatment works. We know that every dollar invested in addictions treatment returns over $4 down the road. We've collected all the data. We have done all the analysis. Now what we need to do is drum up the political courage to act on the information that we have. So want to add to that one of the tragedies of the Mannix approach is that we will see even more women going to prison for a long time, leaving their children to an already broken foster care system. And we will be mindlessly participating in generational crime. That would just be tragic and stupid, tragically stupid. Well, first, there aren't enough community-based services for the mentally ill, and that goes all the way back to deinstitutionalization, which was done by the state legislature, and is really another one of the prongs of my candidacy, which is going to Salem and getting a better return on the taxes that Multnomah County residents send to Salem so that we can fund our own necessary programs. The other key to an effective mental health system in Multnomah County, especially as it intersects with the public safety system, is to have a triage center, to have a center where police officers can take people who are having mental health crises that is not the emergency room and is not jail. Because either one of those interventions are expensive and not really appropriately targeted, and it presents the police personnel with an impossible decision-making problem. They're not trained in the diagnosis and treatment of mentally ill people, and knowing whether to take someone to the emergency room or to jail, or to make a placement within the community mental health system is really a decision that needs to be made somewhere else. So we need this mental health intervention center. It's been called a triage center. It doesn't matter what we call it, we need it. Well, gentrification really is the isolation of class. It is a kind of unspoken social policy that says rich people live here and poor people live there. And then what's happened in the poor neighborhoods is rich people have started to invest and push low-income populations out. I mean, that to me is a definition of gentrification and the problem with gentrification. The affordable housing that I worked on in this area was mixed income housing, and all of the experts said you can't get high income people to invest in home ownership in a condominium building that also has incentives for low income people. We successfully blended those populations. I know that that's possible, and I think that there is a partnership that we haven't fully invested in, and we really haven't explored. And I'm hoping that it doesn't take a crisis, or really a disaster in our community to get us to focus our attention and our resources on preparation, because emergency management really is an exercise in communicating with the members of the community so that they can be as well prepared as possible in the event of an emergency. And that means repeatedly offering the list of what you need to take care of your family in an emergency.